Welcome. My name is Dee Goldstein, and I am the Senior Manager of Revenue Growth Strategy at the American Society on Aging. I'm pleased to welcome you to the first in a three-part series on living and dying with dementia. If you have any questions or would like to join the conversation, please do so in the comments section below. Our guests will be answering questions at the end of today's conversation. And now I'd like to introduce my guests for the day. Jessica Empeño is a medical social worker with over 23 years experience as a clinician, educator, and advocate specializing in end-of-life care, dementia, and caregiver support. She is currently the National Director of Clinical Engagement and Education with Compassion and Choices, where she leads advocacy, education, and clinical outreach efforts. Dr. Jeff Gardier is a board-certified clinical psychologist and expert in the field of mental health. In addition to his private practice in Manhattan, Dr. Jeff is Associate Professor and Course Director of Behavioral Medicine at Touro College of Osteopathic Medicine in New York City. He is a passionate educator and advocate for health disparities and end-of-life care options, and is known as America's psychologist. He's also a well-known author and respected contributor to a wide range of television, news shows, as well as documentary films. Jessica, Dr. Jeff, welcome.
Thank you for having us.
Thank you.
So now we know that dementia is a progressive brain disease for which there's no cure. So let's talk about dementia as a terminal condition. We know that it affects so many. I want to share a few stats, and these are from the Alzheimer's Association. 6.7 million Americans aged 65 and older are living with Alzheimer's in 2023. And furthermore, 1 in 2 adults now die with Alzheimer's or some other form of dementia. How widespread is this really? I mean, should everyone watching be concerned for themselves or a loved one?
Dementia is one of those things that I think a lot of people are really concerned about. And for us, this is something we see professionally, but it also impacts us personally as well. And, really, if you don't know someone already who may have been affected by dementia, you probably know someone else who has. So it's pretty widespread, but there are things that you can do to take care of yourself, reduce the risk, and live well with dementia.
I would agree with that 100%, Jessica. We know that most people with dementia, especially from Alzheimer's disease, it's usually are over the age of 65, but we do see that it can happen to other people. It can happen to people earlier on, depending what the brain disease may happen to be, what the physical issue may happen to be. But it's something that we really need to pay attention to because we know even though there is no cure that we can slow it down, but it is important to have it diagnosed. And a lot of studies, Jessica and Dee, are showing that there are some things that we can do to perhaps slow it down even without medication, some things we can do to keep our minds sharper, such as being involved in taking dancing lessons or music lessons or doing anything that is rigorous for the mind. So the earlier we know with anything when it comes to early intervention, the prognosis is always much better as you go along.
And so when I first heard about dementia many, many years ago, I also heard of the term spoken about in conjunction with Alzheimer's. Can you kind of back us up and talk a little bit more about what's the difference between Alzheimer's and dementia? Are there different forms of dementia? And how someone might know if they're experiencing symptoms of dementia or someone they care about is experiencing symptoms of dementia?
That's a great question, Dee, because we hear a lot about dementia, but at the same time, dementia is one of those things that is so widely misunderstood. Dementia is really a general term that we use to describe changes that are happening in the brain. And these are changes that at the point that they get significant enough to interfere with your daily life, with your regular daily activities, that's when we start to be concerned. There are so many causes and so many reasons that you could be experiencing different changes in the brain. There are reversible or treatable causes like UTIs. Urinary tract infection is a very common cause of cognitive changes. Things like medication interactions, dehydration, other types of illnesses, even malnutrition, not getting enough nutrients and feeding your brain, giving it what it needs, can cause those kinds of changes. When those changes are then caused by something that is not reversible, it could be caused by Alzheimer's disease. It could be caused by Lewy body dementia, frontotemporal dementia. Each of those are different types or causes of dementia that each have their own set of symptoms, their own characteristics. Most people think of memory loss when they think of dementia. And for people with Alzheimer's disease, which is the most common type or cause of dementia, that is usually the thing we start seeing first. But what we also see is a lot of difficulty with cognitive functions, with thinking through a situation, with being able to follow a series of steps and making good, sound judgment and decisions. You may see changes in behavior, in personality. You may see changes even in being able to kind of control emotions. So there's a lot of different changes that we see as the brain is coping with what's happening and this disease that's taking it over. There are, because like we said, there are different types and causes of dementia. This is why it's so important, if you're experiencing changes, if you're concerned, to talk to your doctor, talk to your healthcare team about what's going on, because getting that diagnosis is so important. Because if it's treatable and there's something we can do, and I've seen it happen, those symptoms can be reversed. People return to a high level of functioning. If it's not treatable and we're dealing with another type of dementia, then we want to make sure that we are treating it appropriately and prescribing the right kinds of medications, talking about other things like clinical trials and living well and other things that we can do when you're living with a dementia.
I absolutely agree. Great commentary. I took some notes, and I'd like to add on, Jessica, to some of the things that you said, and indeed directly to your question. So we need to know the difference, and this is exactly what Jessica was talking about, the difference between a delirium and a dementia. You know, we talk about people, oh, they must be delirious. We hear it in the music. They're so in love, they're delirious, right? So, you know, when we're dealing with a delirium, it's exactly what Jessica's talking about. You can get that from a UTI. You can get that from, you know, a side effect of a medication and so on. And it is usually reversible. With dementia, we find that it usually is not reversible. So we have to pay attention to that. Also, we know that at the age of 60, for example, and above, that 40% of us will have something that we call cognitive slippage. In other words, you know, as we get older, we forget little things here and there. But that is the call to action, to start working on exercises to keep your mind sharper, and so on. So I think it's really important that we pay attention to any of those changes that Jessica has been talking about. There's certainly things that we can do that are very important to keep us strong in that way.
And it's really important to note that dementia is not normal aging. Like Dr. Jeff was saying, there are things that are normal that change as we age, right? We experience changes in our eyesight. We experience changes in our skin, in our digestive system. There will be changes in the brain. The example I like to give is, you know, it's not about forgetting your car keys. We all do that. It happens all the time. The difference is you have them in your hand and you're not sure what they're for. That's when I might want to have, you know, look a little bit closer. So
That's a good distinction.
keep in mind that dementia is not normal aging. And so just kind of writing it off as, oh, she's going through menopause, it must be stress, she's not sleeping. We want to look closer and find out what's really going on.
That's a really great reminder to advocate for ourselves and our health, but also for the health and well-being of our loved one and those around us. And I think you made a really good distinction between what can be a normative stress response of, oh, I've had a moment of forgetting where I placed something, versus really a sign of possible cognitive decline, and how important it is to get that checked out. The sooner the better.
That's right, Dean. Let me tell you something. I am 67 years old, going on to 68. And I will tell you, and I see some comments coming in about some of these things. As we get older, we may not be as mentally as sharp as we like to be. I think there's much more wisdom. We're much more creative at a certain age. I have a positive spin on getting older, of course, but I also realize that there are certain things that I can start doing now, knowing that sometimes I get a little bit more tired cognitively. So, I have to do lists. I put things where I know I'm going to remember where to find them, make them easier to find. Jessica, perhaps we'll talk about this a little bit later. If, God forbid, that you do develop dementia, one of the first things you want to do is reorganize the house, make it
Yeah.
friendlier, make it a place where you're not bumping into things, that you can remember exactly where things are, label where things are, and so on. But as far as this normal aging process of not always being as sharp, some people even sharper, if you ask me. But, bottom line is, do things to begin helping yourself. So one of the things I do with one of my patients who actually is, having some real cognitive slippage. It's not dementia as yet, but cognitive slippage. It may not become dementia, but she gets really anxious. Jessica, you've dealt with this with your patients. She gets really anxious when she can't remember something, and she immediately goes into, oh my God, it's because I'm 72 and what's happening? And I say to her, if you can't think of the exact word, then think of a very similar word or similar idea to express yourself and relax. You'll get the idea out.
Yeah, give yourself some grace, right?
Yeah.
As we age, especially if you're dealing with other health concerns. We have a question about, just remember forgetting recent details. Yes, that can happen. That can be common. So, give yourself some grace around that. If you are dealing with other health conditions and chronic diseases, if you're taking medications and have other things going on, those kinds of things are to be expected.
And I think it's also important to remember the ways in which we subconsciously are ageist towards ourselves. And so we may downplay our symptoms that might be really serious and say, oh, I'm just getting old.
Yeah, and we shouldn't be downplaying our symptoms in any way. One of the things that I've done as a senior citizen is, I'm not just a hair club president, but I actually wear the hair, though you can't see it's getting hair today, gone tomorrow. And so, as a senior clinician, I find that it is very important for us to have regular visits with our health providers, making sure that that we talk to our neurologist if we see that something is starting to happen. Again, early intervention, knowing what's going on. Don't be so afraid, because if you can address these right at its infancy, then certainly the prognosis is better, and you're much more empowered to be able to deal with whether it is a memory issue, whether it is even dementia, but be empowered and keep working towards better living.
So if someone is already in kind of the early to mid stages of dementia or even late stage dementia, are there any treatments that are available, any cures?
So I think one of the important things to know is, especially with the media and the news that we're hearing lately about the new medications that are coming out, there currently is no cure for the different types of dementia that we talked about that are untreatable. So Alzheimer's, Lewy body, those types of dementias, there's no cure. There are things that we can do to focus on living better,
on maybe even slowing the progression of the disease. So focusing on what does it mean to live well? And guess what? A lot of it is the things you probably already know. It's managing stress. There's a tremendous amount of research on the impact that stress has on the brain. And we know that stress affects our sleep. Sleep, there's so much amazing research about good sleep and how important sleep is for the health of our brain. And the other things, basically focus on everything you know about what's good for the heart is good for the brain. So getting that exercise in, doing things that gets your heart pumping and gets that blood flowing to your brain, eating well, all of those kinds of things that you probably already know you should be doing, but maybe we don't prioritize enough, is taking care of yourself and living well. And then taking care of your other chronic health conditions. So if you are taking a lot of medications, let's look at what kind of interactions you could be dealing with. Let's make sure that you are staying hydrated, right? All of those kinds of things will definitely make a difference in life with dementia.
That's right. And Raina talks about that too. Polypharmacy, right? Taking a bunch of different drugs to treat a particular ailment can cause some issues with possibly what looks like a dementia, or what may look like some sort of a delirium and so on. So we have to be careful with that too. And Jessica, again, great points. Taking care of yourself before you may absolutely put yourself at risk for dementia. Now, what do I mean by that? Well, as we know, when we're dealing with Alzheimer's, when we're dealing with Lewy body, frontotemporal dementia, some of these things may be much more genetic, right? But when we're dealing with something like vascular dementia, right? And Jessica, if you could talk more about that. This vascular dementia is really telling us that, perhaps you've had heart issues, you've had brain issues, you've been a smoker, you haven't really taken care of yourself. So therefore you may end up having heart attacks. You might, end up having, some, occlusions to the brain where you're not getting proper blood flow in the brain and so on. And so those things put you at risk for dementia. So, and we see this in many communities. In my African American community, that's why we see dementia sometimes starting at an earlier age due to all of these health problems. So 1 and 1 equals 2, still, even in this political system that we're in, right? That's the truth, no disinformation. So it's really important for us to understand, just as Jessica's saying, if you take care of yourself, then you're not at risk for vascular dementia, and therefore, you're in a better state.
And I want to really highlight the comment from Sydney. Thank you so much, because you're absolutely right. Doing things to challenge and keep your brain healthy is also something that you can absolutely do. So Dr. Jeff talked earlier about taking a dance class, learning a language, learning how to play a musical instrument. Those are definitely things that you can do. You can also do other things. There are lots of puzzles and different types of brain stimulating activities. Don't just think about the things, doing the same crossword puzzle all the time. That's good for your brain, but you want to challenge your brain into new and different things. So even something as simple as socializing, right?
That's right.
Reducing isolation, having good conversation that's challenging your brain to come up with good conversation and witty things to say. Those can also be really good and part of a good brain fitness program. And there are lots of different websites and books and all different kinds of things that you can do. But what you really want to focus on is introducing your brain to something new and different and challenging.
And challenging, that's right. That's why I started taking piano lessons at my old age. And I've got to tell you, I was playing Body and Soul the other night, and I said to my teacher, well, how does it sound? He said, it sounds great. Now try it again, but take off your boxing gloves.
Yeah, so that can look like so many different things, right? Music is amazing. Music taps into a place in our brain different from where language functions in our brain. Music has so many benefits, and just, oh my goodness, I could go on and on about the benefits of music and how it affects the brain. So yeah, you can do things like that. You can, try taking, when you go on a walk, take a different path. Right. So try to break some of those habits. There's a lot of benefit in routine, especially if you are maybe more in the middle stages of the disease. There's a lot of power in keeping routines because it does help you. But if you're trying to challenge your brain, try something different. Try using your non-dominant hand for different tasks. And you'll start to see some differences there, and it's fun.
So we've talked about a few things that I've heard you guys mention. We've talked about creating new routines. We've talked about trying something new, developing a new hobby, learning something, spending time interacting with our friends, loved ones, and community. Those sound like a lot of the things that we at ASA talk about with regards to reducing social isolation and improving overall health and well-being.
Yeah, absolutely. Studies are being done right now that are looking at whether there is a correlation between isolation, depression, and the potential of being at risk for or actually developing dementia later in age. And this again goes back to Jessica talking about the importance of interacting with other people. It keeps our neurotransmitters, serotonin, dopamine going, which are very important. What we call the excitatory neurotransmitters. There are certain hormones that we see an increase in when we're spending time with other people and have positive emotional experiences with them. And I think the bottom line is the happier that you are, the more connected that you are with other people, the healthier that you are. And that may actually help you in not being as much at risk for something like a dementia. But again, the studies need to be done on that. We're just using common sense here. But at the end of the day, being able to stay connected with other people also means that you're not in isolation. So if you're not noticing yourself that you are having some issues or some emerging issues as far as cognition and starting to forget things or possibly even the beginnings of a dementia, those people around you will be able to lovingly, and I'll say it again, lovingly point out where some things are starting to happen and what it is that you should be doing as far as getting a complete physical exam, neurological exam, talking to a neuropsychologist or social worker, whatever the case may be. It's really important that you are connected to others in just so many ways.
I can't
Now,
emphasize
please.
that enough. Dementia in older adults does not show up the same way that it does in younger adults. Dementia in older adults can look like forgetfulness. It can look like confusion. It can look like disorientation. So it is one of those things that we know is a risk factor for dementia. We also know that dementia and depression can make each other worse, and they just one pulls the other down. So just to really highlight what Dr. Jeff is saying, absolutely, if that is something that you're experiencing and isolation is a part of it, if you're depressed, you're not taking care of yourself as well, you're at more risk for some of the other risk factors. Everything is related.
And you mentioned social isolation. That was a really big concern, particularly for older adults during the COVID-19 pandemic. And GJ uh, said he's looking forward to the latest updates on the impact of COVID-19 upon dementia risk. Can you touch on that a little bit, both with regards to the well-being risks as well as some of the health risks for someone who may have had COVID or long COVID? Are there studies out there that are looking into this?
This is such a fascinating question. There are some research studies. They are limited since COVID is still something we're still living with, right? But what we do know is COVID really attacks the lungs and the brain for a lot of people. And so Dr. Jeff mentioned vascular dementia earlier, and that is a dementia that is caused by an interruption of that blood flow to the brain. And so if you dealt with COVID, if you were on a ventilator, your risk of dementia, your risk of those cognitive changes caused by COVID, caused by those interruptions in blood flow and interruptions in oxygen, yes, we do know that some of that can increase the risk of dementia. One of the interesting things with dementia is that there is no, real clear correlation. We still don't have clear information as to what causes these changes in the brain. We know what some of the risk factors are. We know that it can increase likelihood, but there is no direct cause for the different types of dementia. So that makes it hard to answer some of the questions. But we do know that COVID has had an impact on dementia, and then also just all the ways that COVID changed our lives and what impact that had on somebody with dementia, increasing isolation, changing routines, all of those kinds of things is definitely been an impact.
And that is true for younger and older people, right? Because you can see signs of dementia in older adults, but what is that starting age where we're starting to see some of those symptoms?
I think for the most part, and Jessica, correct me wherever I may be wrong here, but we're starting to see when it comes to older adults, uh, 65 is usually that number where we see that there is an increase in the risk of having dementia. But we see it for some people with regard to vascular dementia at a much lower age, 60 years old. Some people maybe even a little bit younger than that. Frontotemporal dementia is something where, again, that's really much more related to genetics, but there are other possible causes too, and so we see a younger age there with that happening. That said, we also have people who develop a very early form of dementia, perhaps even in their 50s, mid 50s, and above, but because they're so young, we don't realize that it is a dementia that is incrementally and slowly developing into something that is much more serious. Right, Jessica?
You're absolutely right.
And so we've talked about today some ways that we can help improve our cognitive function, be on the lookout for the symptoms of dementia in ourselves and in our loved ones. But if you have dementia, if you're caring for someone with dementia, what should you be thinking about in terms of your surroundings, in terms of your lifestyle and day to day functioning?
One of the first things I really want to emphasize is if you care about, are living with dementia, you're not alone. And I've heard so many people say, yes, yes, but my situation is unique. Everybody's situation is unique. And there's a lot of help and there's a lot of support out there. And there's a lot of people that would love to connect with you. There's so much power in families and caregivers getting that support from each other because they're going to understand what you're going through like nobody else will, right? So there's a lot of great organizations. We're posting some links about some help that's out there. There are supports everywhere from information and education. Understanding what you're dealing with is, I think, one of the very first things to do. And then getting connected to those resources. So there's things through the VA, there's things through different organizations, Family Caregiver Alliance, so many local great organizations. If you're here in Southern California like I am, there's great organizations like Alzheimer's LA and Alzheimer's Orange County, Alzheimer's San Diego. Also, think about what lies ahead. The more you can be open and honest and talk candidly, talk with the people around you about what's important to you. What are your values? What do you want? What do you want that future to look like? And do some of that advanced care planning. That is so important. And that's going to make such a difference in making sure that you get the type of care and the type of support that you want throughout the duration of your disease.
Absolutely. I agree wholeheartedly. One of the first things that we do want to do for anyone who is diagnosed with any kind of dementia, I think I mentioned this earlier, is to make sure that we change the environment that they're in and make it much safer, make it much more familiar, kind of shrink it a little bit so everything's not in the unknown or dark places or what have you, label things and so on. I believe it makes that individual with dementia feel much safer, and hopefully, staying healthier, making sure that they get all their physical exams, that if they can be placed on medication, to help with regard to slowing down the progression of dementia, whether that's a right fit. And more than anything else, if you're caring for someone with dementia, it is important that you are part of a support group, that you get support, whether it's online or in person, because that is one of the hardest jobs, taking care of someone with dementia, not just because of the physical labor that comes with it, but it's the emotional aspect of that, especially if you're taking care of a parent, because it's something that really rocks you to the core when you see that someone may be declining in that way. So therapy is so important. And Jessica, of course, what you've said, making sure that there are advanced directives, making sure that all of the treatment is available, making sure that there are health proxies, because this is something that can have a fast decline or a very slow decline. But either way, you want to be prepared every single day and make sure that the quality of life for the person with dementia and the person who is taking care of them is always, at a very, very high level.
Yeah, there can be so much to think about. Safety, like you were saying, is definitely top of that list, as well as the support, looking at where can you get help? Where can you get that hands-on help so that you as that caregiver can get a break? It can be overwhelming because there can be a lot of things to think about and a lot of things to coordinate. So reaching out, being open, being honest with yourself about what your limits are, and having those conversations is really important.
So lots of intersections with accessible housing, health and well-being, mental health, caregiving. It's all interconnected. Before we wrap up today, I do want to address one of the questions that came in. Karen asked, what are your suggestions for encouraging people of color to participate in dementia research?
I love this question so much because it is such a need. All research, really, all medical research, but especially research around dementia and Alzheimer's disease and other related issues, have not historically included people of color, have also not done a very good job of including women in general. It's usually older white men that are doing the research, and older white men that are included in the research. And so a lot of the information that we have is based on that. We absolutely need diversity in research and in clinical trials. There are so many different organizations. There are different universities. Also, the National Alzheimer's Disease Resource Centers have some different initiatives where they're focusing on including not only African American, but Hispanic and Latino specifically in their research. So there are so many different places to get connected. The Women's Alzheimer's Movement has connections. Alzheimers.gov has connections. Almost every university out there has a research initiative and connect you to current clinical trials.
So I'll give you an example as to why it's important that people of color get involved in the research, whether doing research or actually participating in the research where they're being studied. We're all created equal, but we're all different. I take a particular medication for hypertension that works better for people of color versus for people who are not Black, for example. That has come from the research that has been done on multicultural research and not just on white people. And so we have to look at why people of color, for example, why they are more, perhaps could be more at risk for vascular dementia in some particular areas. How does racism, for example, day-to-day racism affect the body, the system, the brain? Can that, in effect, that daily stress of living in America as a Black person or a brown person, can that affect your brain functioning? Could that put you more at risk for brain conditions, heart conditions, and so on? The medications, a lot of new medications are coming out. How will those medications affect a person of color versus a person, who is white, for example? Which medications might be better? So it's really important for us as Black people, as brown people, and others, underrepresented minorities, to make sure that we are part of this revolution in positively addressing dementia.
Thank you. And thank you all for your questions today. We have gone a little bit over time, and so I'm going to wrap it up for today. If you have additional questions, please leave them down in the comments, and we'll try to get Jessica and Dr. Jeff in the comments to answer those over the next week. We will be back next week. Join us for part 2, When the End is Near, Preparing for Late Stage Dementia. That's going to be September 14th at 11 a.m. Pacific, 2 p.m. Eastern. In the meantime, if you would like to rewatch this ASA Live, or you'd like to share it with anyone, you can go ahead and view it on demand on the ASA Facebook page, as well as on the ASA YouTube page. Jessica, Dr. Jeff, thank you so much for joining me today for this really important and in-depth and exciting conversation. And I look forward to connecting again next week.
Thank you. See you next week.
Thank you.
Thank you, everybody. Bye-bye.